Hi guys, Rishi Sunak and his government are not considering what's currently happening to the NHS as a crisis. This is bordering on criminal. Waiting times for ambulances have gone through the roof to a stage where people are dying in their homes as they're unable to access the emergency services they need. People are dying in corridors because of a lack of staff and the lack of beds to treat them, and those who are fit to leave hospital can't because there's no room in social care for them. All this, and the Tory government is refusing to call it a crisis. Have a listen.
They also say that they are very thankful to the staff that are working through winter to try to get through these difficult periods. Of course, they are, separately from that in a pay dispute with quite a few of those staff, nurses, ambulance drivers, of course. What they do say as well, though, is that this was very much anticipated, the pressures on the NHS this winter, because of the COVID backlog, because of the pressures that were put on the service during the pandemic. They also say that the first week of January, it is quite normal for the NHS to see some of these pressures as well. So I think what's quite interesting, though, is that the Prime Minister certainly has no plans in the next week to go on a visit to a hospital or even to be seen in public at all. At the moment, what we understand about his diary is that he will be having the normal meetings in Number 10, but we probably won't see him. So maybe to some extent wanting to keep a distance a little bit from this issue. The same currently as well for the Health Secretary. No plans at the moment to hold any public events or to address any questions on this. I think generally the feeling that is coming across from the government is that there was an expectation that there would be pressure at this time of year, given everything that's happened over the past couple of years, on the NHS, and there are no plans for any big new funding announcements, any big new reforms. They will work through this period. They're going to dig in and wait it out, and we probably are not going to see the Prime Minister front and centre. The Prime Minister's spokesman didn't even want to call this a crisis today. He wanted to call it an unprecedented challenge. So that is the perspective on the NHS pressures and struggles that we are seeing at the moment from Downing Street.
This was all anticipated. This is normal. And the fact that the Prime Minister, Rishi Sunak, is not going to deliver any speeches about this, he's not going to deliver a press conference about this, he's advising his ministers to do the same. Just ignore it. Ignore the crisis and it will go away. Ignore the fact that ambulances are queuing up outside hospitals, treating people within them. People are dying in corridors. People are dying in their homes because they can't actually access these ambulances in the first place. And just ignore it. Because the priority is the Prime Minister. The priority is the party. Protect the Prime Minister and protect the party. That's what it's about. It's not about the public. It's not about even the nation. It's about protecting the party. This is bad news. This is a bad look for the Prime Minister. And he believes that if he ignores it, it will go away. This bunker mentality, I don't think is going to work. Now, they've mentioned here that, or the journalist is saying what the government has been saying is this is all perfectly normal. This was anticipated. Well, I want to show you something. This is a nurse who quit the NHS. Let's hear what she had to say.
I would often be brought to tears during my shifts because there was just so much pressure on me. When I graduated, I was so excited. I really wanted to do a job where I could make a difference and help people. But I've found, as time has gone by on the wards, things have just gotten more and more stressful, and we've been under more and more pressure.
It says here, after 2 years working in the NHS, Mary quit her job as a nurse. This video, you can see here, is from 4 years ago. Not this year, 4 years ago. Which means that this is not a new crisis. This is a crisis that has been in place for a long time. 4 years ago, who was in charge? The Conservative Party were in charge. So this is, once again, and this is the narrative that they're going to try and push. It's the pandemic. It's, the whatever, war in Ukraine, whatever excuse they want to pull out and say the reason the NHS is in crisis at the moment is because of the pandemic. It's nothing to do with the Conservative Party. It's nothing to do with the Tory government. We've been properly funding. Here's a nurse who quit because she couldn't cope any longer, because of the way the NHS is being underfunded, the stress that's put on its staff. And the response from doctors, this is from Tuesday, doctors criticised delusional Rishi Sunak for denying NHS is in crisis. Because if Sunak admits that there is a crisis, then he'll have to answer the question, why is there a crisis? And he can't continue to blame the pandemic and say, well, it's because of COVID, because of the return after that. Because this crisis, as we saw, began a long time before the pandemic. This is part and parcel of a Conservative Party that has been determined to drive more and more people into the private sector, defund the NHS, grind it down, discourage people from using it, and encourage them to rely on the private sector instead. This is the Tory ideology. The private sector does a better job than the public sector. And of course, not everyone can afford to go to the private sector for treatment. Not everyone can afford to have health insurance. Not everyone can afford an American-style healthcare system. But some people want to push that. And, the writing is on the wall now. If the NHS is not properly supported, if this is not turned around, then it will collapse. And the fact that the Prime Minister is basically on holiday at the moment, avoiding questions, doing a Boris Johnson, is disgraceful. And I hope the Labour Party will call for him to resign as soon as Parliament opens, because this is a massive crisis and he's asleep at the wheel. He isn't even at the wheel. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.